All right, hello everyone. You're listening to Unidos Unplugged, the podcast where community culture and wellness take the spotlight. My name is David Villarreal, UCD Outreach Specialist, Unidos contra la Diabetes. I'm joined here with my director, Mr. Moises Arjona, and with Dr. Paulina Sosa. And thank you so much for joining us and being part of our Unidos Unplugged podcast. And on that note, if you would like to introduce yourself, Dr. Sosa, and tell us a little bit about yourself.
Sure. Well, first, congratulations. I'm so excited to see the podcast go live. It's such an honor to be here with you all. Thank you for the invitation. And just a little bit about myself. My name is Dr. Paulina Sosa. Still getting used to saying the doctor part. Based in Harlingen, Texas, but happy to do the work that we do nationally with other partners. And excited to get into the conversation.
Cool. So, yes, congratulations on completing your PhD and being a doctor. It's not easy. I actually never wanted to be a doctor. But I started recently looking, because our previous speaker, Roxanne, and now you both are, and she's in the PhD program, and you just completed your PhD. And then Lupeth Perez, Dr. Perez now. I was like, man, I'm sorry about all these PhDs. I need to go into the PhD program. But then I looked at it and I was like, nah, I'm not into it. It's just too much work. It's a lot of work. So kudos to you, and you finished that product great. So tell us a little bit more about Latinx Voces.
Sure. So I guess the elevator pitch, and then we can go into the history of it in a bit. So Latinx Voces is focused on health education, health outreach in the community, specifically in the Latino community. But of course, we know our communities are all intersected. And so while that's our focus in health, we also focus on cultural celebration, showcasing, and we do that through showcasing our small business owners, our artists. Of course, we know education's another big part of the work we see and need in our community. So we do a number of things, but health education, health outreach is the primary focus, and then of course everything that follows that in after that.
Yeah, and I noticed that, when I started attending your meetings, you don't have a lot of people just stationed in Texas. They're outside. Mm-hmm. You just reach national. You have CDC, you have some pharmaceuticals, you have just a little bit about everyone working together who is in the community, whether it's at a grassroots level or another level, but you really try to keep it to what's going on in the community at a grassroots level. So can you talk a little bit about that?
Yeah, no, thanks for pointing that out. And the way that I like to kind of word the work that we do is that we work local, but we also focus national. And so we have at this point over 400 partners nationally, which is amazing. Yeah. And that started during the COVID pandemic, right? One of those collateral benefits, we like to say that, at the time, and I'm sure many of us remember, right, we needed to work together.
Yes.
And so working with our federal agencies, like you mentioned, CDC, HHS, working with national associations like American Medical Association, national associations like Compassion and Choices, and then, of course, working with our health departments, state, county, local, and, of course, our local nonprofits like you all. The work that you do on the grassroots level, I think, really should inform what everyone on the national and federal level is doing, right? And so that's part of why we wanted to do this multi-sectoral, multi-level coalition that we've started, and it's exciting kind of seeing it continue to expand.
Yeah, and it continues to expand and grow, and I think I really love the fact that you're bringing everyone together, because there's a lot of stuff that happens as far as miscommunication. And right away for our population, the people that we serve, communication is key. But because we like to listen to la vecina chismosa or la vecina who thinks she knows it all, we get things lost in translation. But you really bring everybody together to go ahead and talk about what it really is and how to decipher some certain changes that came in, especially during COVID for you. And as you mentioned, and you continue keeping going, I think that's really important for us that we focus on and keep that going.
Absolutely. And I think you touched on a big one, right? Misinformation, disinformation. And a lot of people associate those terms with the COVID pandemic. And of course, COVID, we saw a lot of that, but we continue to see a lot of that, right? And it ranges, whether you're talking about diabetes prevention, whether you're talking about mental health, stigmas around mental health, whatever you're referring to, there's always going to be counter voices in our social media channels. So how do we make sure we're getting the correct information, correct resources out to nuestra comunidad, right? It's about getting that right information to them.
Right, and I think there's a lot of vaccine deniers, people who don't like vaccines or are anti-vaccines. I am pro-vaccine. I love vaccines. If I can get another 10 COVID shots, I don't care. Just give them to me. I'm afraid of everything, catching everything. I'm all for getting vaccinated. But, we've seen something happen in Texas that hasn't been seen for quite a while, is this measles outbreak, right?
Yes.
And it started in a small community for religious beliefs, and it spread because at the same time, we have other folks who are have asked for an exemption from vaccines because they are not sure that the vaccine is been tested properly or whatnot, or for their own personal beliefs, nothing to do with religious. But guess what? That has just spread and spread. And I think now we're seeing it also in Ohio, I think, or I don't know.
A couple different states.
Yeah, so it's spreading.
It's spreading.
And it's funny because the public health departments have an amazing job that they do, right? They create this whole tree to figure out who's patient zero and where they went, right? And somebody went to Buc-ee's, and I'm like, oh my God, I was at that Buc-ee's. Am I a carrier? But you know what I mean?
Right, exactly.
Yeah, do I need more vaccines? What's going on? So I think that's one of those things that we need to always figure out on our misconceptions and myths and stigmas about what's going on in our community. I think you do a good job of bringing it together. I also think you do a really good job of also starting your emails off in Spanish, making sure that everybody is included in your email. So tell me why you do that.
I think one of the biggest things that we're trying to do is, kind of going back to the partnerships, right? A lot of our partnerships are also with our promotores de salud, right? And so we want to make sure that everybody that is part of our coalition, everybody that's intaking our information, knows knows what's coming up, knows what information they need to know. And so we really do try to do everything in both languages, in English and Spanish, because of that reason. Part of kind of walking the talk, so to speak, right?
Yeah.
We're practicing what we preach. And, I will say that having everything translated is also difficult, because it's not just a matter of Google Translate and just, it's much easier to just do it that way. And maybe some of the listeners can kind of, feel the difficulty of having everything in both languages. But it's a matter of working together with the community and making sure that what we're putting out is also relevant in Spanish, right? And so what words are we using? How are we making sure that the words really hit the same in different communities? And so, of course, we have our national reach, and we have our newsletter and our website, and you got to kind of just have two versions. Yeah. But when you're doing community specific, that's really where the fun comes in. And you're working with those promotores, you're working with local organizations to make sure that they have the information they need in the right dialect, in the right language. But it's even here in the Valley, right? Even here in the Valley, it's real different than if you go up to San Antonio or Dallas. It's different across the board. And so I think it's something that we continue to strive to do. And I hope we're doing a good job at doing that, but we want to continue to strengthen the work around that.
Yeah, I mean, we have our own struggles here at the office. There's 5 of us, and we all think that the word needs to be worded differently.
Right, a different phrase.
Yeah, different phrase. It doesn't sound right, and then we argue, and then we try to. So then I think this is so ugly, but the way we go ahead and just say, okay, you're the winner, and you're right, is who has closest lineage to our historical roots, right? So if you have family that still lives in Mexico and you still go to Mexico, then you're the one that can use it, right? It's one of those things, right? Because I'm removed, right? So I think it's one of those things that, okay, so you have the expertise. No one's going to take it from you. So I think that's how we ground that. But it's funny how we all do that. The dialect is really important. The tone is important and all that kind of stuff, especially when you're working with our community. Absolutely. And you mentioned promotoras. And the promotoras, they will correct you. They're not shy about correcting you. And that's why they're that bridge, right? That's why they connect the community together. So Great. So how other ways are you working with promotores in the community?
Yeah, so actually, one of the cool things that we're about to launch, this is a first for us. We're trying to do more capacity building, right? And we've worked with promotores since the start of Latinx Voces, and promotores were huge support and help during the pandemic, as I'm sure we all remember, right? And they continue to be a huge resource and a bridge for our families. So what we want to do is provide more capacity building workshops. We have gotten so many requests across the board, not just from promotores, but from nonprofits. Okay, well, what kind of resources can you provide in data collection, right? We know data collection is a big part of what we do. So, so we're actually kicking off a series. It's our summer luncheon series this June, going into the summit.
Oh,
So we're
cool.
kind of doing this series, and then that's going to take us to the start of that summit in November. And so every series, every workshop is going to be focused on a different capacity building topic that's been highly voted by our partners and by promotores we've worked with. So that's one way, but we try to integrate as much of what we do together with promotor networks as well.
Yeah, I think you touched on a really important point about the data. I think one of the hardest things that I've learned working with promotoras is we ask them to collect all this information, but we don't tell them the whys, and then we don't show them the final product.
Oh, yes.
Once you show them the final product, they're like, oh, I didn't realize that this sheet of paper with 20 questions did that.
Right.
But it also allows them the opportunity to learn and probe and ask questions at the same time. And I think one of the other things that we've learned recently, we've been working with some student ambassadors who are going to be out in the community being professional promotores de salud, is we did a bad, and I'll say it, we did a bad job of thinking they knew how to data collect. Here's a cute survey, get it answered, and they missed spots. So then we went back and had to look at, why would somebody miss this spot? Why did somebody miss this question? Were they trying to avoid the question or not? Well, we realized that it was a survey format. And we had to go back and look at it. So when we start off our new ambassador training for the youth, we're going to incorporate a data collection survey tool module in there and saying, this is what the survey is, and make sure everything's collected. And if not, put a little notes. The parent refused to answer a question or something. That way we know, right? At the same time about data collection is data doesn't lie, but data does tell you some things. So one of the things that we want to look at, and this is just in general, not with our youth or anybody else in general, but something that we've learned the hard way, is you start looking at patterns. So then you're like, hey, were you really data collecting, or were you filling them in yourself thinking I'm not going to get caught or whatever, right? So I think it's one of the, and not that people are trying to mislead the data, but this is data that's being collected that needs to have integrity, and we need to have people who are collecting it in a correct manner with integrity, and that way we can evaluate it correctly. Because we're making decisions off of this data.
Exactly.
Yeah.
And I think you touched on a really important point, right? Data collection is in many ways the first step, or at least a lot of us think it's the first step, but it's actually survey design.
Right.
It starts at how are we designing and how are we wording the question? How are we wording the choices? What kind of information are we giving to those that are helping with data collection? And then absolutely, the data tells a story every time. And I think that is what's so powerful about data. And I know it's easy to kind of overlook data as a key source of power, so to speak.
Right.
And that's policy comes from that. Funding decisions come from data. And so how can we empower our data even more, right? And so,
Yeah, because whenever you mentioned grants, you're writing your grant, you're writing a grant report and whatnot, the data is going to dictate how what information you put in there, right? And tells you how you can go forward when you apply for funding with additional funders or for additional funding for following years, right? So I think it's really, really key to make sure that we maintain all that. And, we just, sometimes we don't do a good job of training people how to collect data.
Absolutely. And that's actually one of the big focuses that we're going to be pushing, partially because my doctorate dissertation was pretty much entirely focused on data collection, visualization, and integrating the health equity piece, but also the decision support piece into our dashboards.
Oh.
And so I'm hopeful, and God willing, we'll be able to turn that research into a training And that's something that we'll be able to start to diffuse out into communities and into our health departments, into different counterparts and partners that do this and that use data for critical and important decisions.
Right. And part of the collective impact model is sharing data, continuously among partners. And one of the biggest challenges that we have is some partners don't like sharing data. And
Right.
for me, it's one of those things that's, it's a huge organization such as a university or a health system. I get it. But for the local nonprofits, our grassroots organizations, we've noticed that sometimes they feel that their data collection tool isn't the best, and they're kind of like, well, you're going to judge me? No, we're not going to judge you. We just need aggregate data. We just need this to make it successful. But at the same time, part of the collective impact model that we do follow is also providing that technical assistance. Do you need help setting up a dashboard? Do you need help doing that? And we've done that with a couple of partners. And guess what? They are able to now show their data in a dashboard and in an impact report.
That's amazing.
And so don't be afraid to share data.
Exactly.
We're here to help people with
Yes.
data and stuff and ask questions, right? That's part of the whole deal there. So cool.
Yeah.
So you talked about the summit. So tell us what's going on.
So the summit, it's our first annual summit. We're very, very excited. This has been something that partners and colleagues have asked for since COVID ended. So this is about 2 years coming. So what we're doing, and we're trying to make the summit a little unique from maybe your typical conference, right? And the way that we're doing that is by also integrating or adding a cultural element to it. So you got your Latinx Health Summit. And that is purely focused on health topics, right? So you're going to have 2 tracks. You're going to have health education, and then you're going to have professional development, one of which will be on data. So that's exciting, and we're hoping that that'll be a huge resource not only for our local partners, our promotores, students from our different universities here in the Valley, but also to our national partners. So we're hoping that many of our national partners will be able to come visit the Valley, come to Brownsville, come, really check out the gems that we have here in South Texas. True South Texas.
Right? Yeah, true South Texas. We are.
And so that's the first part. And then right after that, what we're hoping and we're excited to do is our cultural festival. And so this is going to be an opportunity to showcase the gems, the cultural gems of Brownsville and the Valley. And so that includes our food, which, I always tell people we got the best tacos here.
We do. Yes, we do.
So we got our food, we got our music, really highlighting some of the unique music we have here, the arts, our artisans. We have so many cool artisans out here in the Valley, and really using it as a time to celebrate.
Right.
And we're not necessarily expecting everyone that goes to the summit to also go to the festival, but we're hoping that it'll translate to that.
Yeah. I think that media gives the Rio Grande Valley a bad rap. South Texas a bad rap. You hear for the last couple of years we've made the top 10 list for the most obese.
Yes.
And you hear about the violence in the border, and you hear about the most diabetics, of course, and now we're listening to or hearing that with the most foot amputations or limb amputations. And for me, when I go talk about things, I say, we are number one in these things, but we have amazing walking trails. We may have amazing hiking trails. We have amazing flowers, foliage. We have people who come down here just to look at the birds.
Bird watching, yes.
We have great stuff. And then, of course, we have our brothers at the border who have great stuff too, right? So dispel the myths about what the Rio Grande Valley really is and highlight the beauty of it. There's a whole... they make it seem like everybody's here is just laying down, eating Cheetos and Fritos all day long. And
we do like our hot Cheetos.
I know, yeah, we do. But, come on. There's a lot of people, there's a lot of movements, there's a lot of walking groups, running groups.
Absolutely.
There's just so much that happens. And you mentioned a few things, right? The artisans, the musicians. We have a lot of culturally grown, homegrown artist, and
Right.
various stuff. And culinary is part of who we are as a culture.
Exactly. Food is art. Food is love. I've heard it many
It's
times
the way
that
we express our love.
exactly. We have our family recipes that have gotten passed down, and we know there in downtown Brownsville, right? There's a number of restaurants that they've been here since 1920.
Wow.
Right? I mean, it's amazing, and that's, I guess, another thing, right? The history of the valley,
Yes.
and showcasing that. So
Yes.
I'm hoping, and I'm excited, right? And you all are part of our planning committee too, which we appreciate. That together we're going to be able to come up with some really unique, fun ideas to showcase this to the rest of the country.
Yeah, and I think we can never, get ourselves stuck into a stereotype of what the valley is, right? Showcase all the great things that we are. We're growing. We are 1.4 million people here in the Rio Grande Valley.
We're huge. It's
Yeah.
a huge
We're
demographic.
huge,
Yes.
and I'm gonna say it. We need more expressways and wider expressways. Doesn't mean I want more more construction. But I mean, it's just growing. It's booming, and people are leaving to go to college, but they're coming back home.
Come back.
They're coming back. They want to stay with their roots. We have a different generation. People would just say, I remember my dad would say, go to school and leave.
Yes. Yes.
You know what I mean?
Absolutely.
And now it's no, go educate yourself and come back home.
Yes, and I'll admit I was one of those, right? When I left, and I didn't think I was coming back.
Yeah.
But Brownsville, born and raised, and you know what? I'm so glad to be back.
Yeah.
I'm so happy to be back in El Valle, back in with my roots. And there's been so much evolution and change that I think is still underappreciated a little bit nationally, at least. That has happened since, I left in 2008, so I might be, I hope nobody's doing the math on my age, but it's amazing to see how much things have just evolved over the years, and it's exciting to see that.
Right.
It is. I mean, I get to go travel a lot and see the world, and when I mean the world, I mean the country. I don't try to call it that stuff, right? Because for the longest time, I thought the Rio Grande Valley was everything. We're in a bubble, and I thought that this was everything. And then what? There's San Antonio, and then what? There's Oklahoma, and there's Los Angeles, and all this stuff, right? You get to see what other states are doing, and there's communities, and one of the biggest things is Latinos are growing, and you have a Latino in every community, and you feel like you're at home. So coming to the valley, you just feel like you're at home. So, and we're very family oriented too. So
We
it's
are.
kinda cool. So it's kind of cool. So what else is exciting going on before we start wrapping up?
Yeah. So I think something else, we've talked a little bit about the workshops. We've talked a little bit about the summit that's coming up. I think, it would be crazy for me to not mention, that we're working on our Luchad health program.
Okay.
And so we have our little mascot, Lobito, and he's cute. We're gonna turn him into plushes.
Okay,
So
cool.
that'll be fun to look
Yeah.
too. But so Luchad Health is, really meant to be what we kind of talked about at the very beginning, right? This multi-sectoral, kind of multi-topic focus on the health priorities of the Latino community. And what's really cool about it, and we're still trying to figure out the best way to highlight this as part of the timeline of Luchad becoming what it is today. But it started in COVID.
Oh.
And so we went on a national tour, 26-city tour, including here, Valley, including different parts of the country and Puerto Rico. And we sat down, we heard stories from different partners, health departments in those areas. What are the priorities here? And we also talked with promotores, and we talked with families. And what are the priorities you're seeing? Not talking about COVID. Not talking about COVID, because there's a lot of COVID fatigue también.
Yeah.
So it's like, what else is important to you?
Right.
So, of course, we know chronic disease prevention was a big one, because that didn't stop during those
It
3.5
didn't,
years,
yeah.
right? We know mental health. That was a really big one. Fighting the stigma about that. We know maternal child health was another big one. So there was literally about 12 health priorities that we had an umbrella for the priorities to include into Luchad Health. We also ran into 4 health best practices, key strategies that organizations and health departments had to get creative in addressing the needs specifically for Latino communities. And one of them was what we talked about earlier, the language piece, right? How do you overcome the language piece if you have no one in your department or your organization that speaks it? And so Luchad Health has brought all of those stories, all of that feedback we got over the tour into a kind of a one-stop shop resource hub for families, but also for our partners. And so the workshop series we're doing is tied to that. We're talking about social determinants of health. We're talking about data collection. We're talking about best practices around cultural competency. And so that program is meant to continue to be a resource for families and partners as we move into, the next chapter of 2025 and beyond. And so we're really excited about that. We just appreciate all the feedback and all the stories that contributed to make it what it is. So that's one of our big initiatives right now.
So do you get our promotoras or people who take it get non-CEUs, CEUs, DSHS approved CEUs? What's the process there? What's going on?
Yeah, absolutely. So all the events that we're doing, and this year's first year, we're doing basically about 2 events a month. So what we're hoping is by the end of the summer, we will be providing regular CEUs and hopefully other health education credits. We know we work with a lot of medical professionals. We want to be able to offer CMEs as well. And there's a lot of different ones. So we're hoping that moving forward, our workshop series will consistently have educational credits attached to it to help with the needs of our community.
Yeah, I think that's really important to have the CEUs, even when it's not non-CEUs, because CHWs do have to go ahead and get their hours done, instructors have to get their hours done, and doctors, medical staff, something always has to have a continuing education component to it.
Exactly.
So that's great that you encompass all that into one curriculum, and it's really great. Cool.
Yeah, so we're excited. We're excited about it, and we're continuing to be informed, by our partners. What do we need to do? How do we improve the work that we do? And more importantly, how do we make sure that Latino health remains a priority nationally, right?
Yes.
And it's not just a matter of saying, pues they need Spanish flyers. No.
Yeah.
There's a lot more that's involved to addressing the needs of Latinos. And so we're going to continue to champion health equity for nuestra comunidad. That's what we're here to do, and we're here to do it together with partners like you all and with the champions in our community that do the work you do. So we're excited, and hopefully we'll be seeing many of those listening at the summit as well. But we're just very excited about what's next.
Yeah, and I think you touched a bit really key base, and I was trying to avoid all this conversation about the current administration and stuff. But right now, since January, we ourselves have noticed that health fairs, because we put health fairs on, and we attend health fairs. Because that's where we get the population or the community to come out and see what services are being provided. They get free screenings. Maybe they can't afford, whatever the case may be for a test or whatever.
Right.
But the organizations are doing it for free. Before, you could just get one little simple, like a height and blood pressure test. But now there's so many organizations that do vision, diabetes, mental health screenings, and foot screening, everything for free.
Yes.
And one of the things we've noticed is that the turnout has been really low. And with the current administration's policies, my fear is that people are not going to focus on their health for fears. They're not going to be attending health fairs, and their health is going to suffer. And that's really scary.
Yeah, you're right. I think, and this is one of those things, right, where you kind of have to go with what changes are happening nationally, right? We had to evolve during the pandemic. We're having to evolve right now. And we've talked to a number of partners where it's like, okay, the funding that you were using before for health fairs or for free screenings, how are you keeping that funding, or how are you having to get creative without said funding? And, really evolving together, I think, is one of those key things. But I think another big piece, especially for our families, is how do we make sure that they continue to have access?
Yes.
And so this is going to force us, many of us nonprofits that are on the ground, to get creative yet again. And, I think we've risen to the occasion every time, and I trust that we're going to rise to the occasion again, to see how we can serve our families in such a time of uncertainty. And of course, our hope is that things will stabilize, and, before the year ends, we have some clear, stable path ahead for providing these services. But in the meantime, what do, right?
Yeah.
To prevent what you just said, to
Yeah.
prevent, health issues from getting exacerbated.
Yeah, and one of the things I've told some of our partners is we're gonna have to go old school, and they're like, "What do you mean go back to hitting the streets, go out door knocking?"
Yep. Yeah.
And we can't focus on calling people because our population. Look, we're in economic disparity. We our folks don't have the money. They might have a smartphone, but doesn't mean that they have it connected to a landline.
Yeah,
We use
exactly.
WhatsApp a lot. I'm guilty of using the WhatsApp. And why? Because you can get Wi-Fi and you can connect to it free, right? But our population constantly is changing phone numbers, so the phone number calling people is not gonna work. And we get so many robocalls for everything
Oh,
that nobody's
gosh,
gonna answer your
yes.
phone call anyway. So I've been saying, we're gonna have to go back door to door, and we're gonna have to do some marketing on that, saying, hey, ex partners gonna be out in the community going door to door, not to people, as it is, even myself, somebody will ring the doorbell,
Oh,
and
yeah.
I'm like,
Like,
I'm not gonna open
looking
it.
through the window.
Yeah, I'm not here. Yeah, you saw me open the curtain, but I'm not here.
Así es. No,
That's it.
I mean, that's
The
how
dogs
it
are
is.
barking, and I'm going, shh. But you know what I mean? It's one of those things I think we have to change our paradigm on how we're going to do things, right? Before we used to hit the doors, knocking. COVID happened, we went to health fairs, we did all this type of stuff. But in order to get our folks done, we're probably going to have to start going and taking those mobile clinics back to the community,
Right.
doing those screenings at home with them, and make sure
Yes.
that they feel comfortable. And at the same time, doing it at an opportune time. And that means, what I mean by that is 8 to 5 isn't going to work for us.
Yeah. Yeah.
We have to work around them.
Exactly.
And if that is from 5 to 9, then that's when we work.
Yep.
Simple as
And
that.
that's hard, right? That's hard, especially for many of us who are like, no, pues yeah, I'm done at 5, done at
Yeah.
6. And, there's been some interesting ideas come up though. It's like, okay, well, maybe we need to throw like a block party or a pachanga in the neighborhood, like they're on their street. And, so I think it's an opportunity to get creative, think a little bit out of the box. But we're going to have to bring in some of those old school methods and so probably some of the methods we had to do during the pandemic where it was similar, right? People couldn't leave their homes. So how are we getting to them if they can't get to us?
Yeah.
So this is a matter of meeting them where they are with what
Exactly.
they need and how they need it.
And how they need it. Yeah. Cool.
Absolutely.
I think that's a good way to close our segment.
One
Oh, you have one question? You have
one fun question, since
Okay.
I feel like our combo really revolved around our culture and just kind of like our upbringing, our roots. Dr. Sosa, what's one thing that you believed as a kid that makes you laugh now?
Ooh. Oh man. Okay. Well, there was this one thing I remember my tia telling me this specifically. She said, "Well, if you eat a watermelon seed, I don't know if y'all remember.
I know it
this
too. I know it too.
I don't know this one.
If you eat a watermelon seed, even if it's by accident, then you're gonna grow watermelon in your stomach." I'm like, what? I didn't mean to. And so, because you're eating the watermelon afuera y todo, right? And
Right.
you're enjoying it, and then you accidentally
You're not
eat
thinking
a seed.
about the seeds.
You're not thinking about the seeds. And so that freaked me out. The other one was chewing gum. I don't know.
Oh, yeah.
You know that one?
Yeah.
Where if you chew and you swallow gum, then it's going to stay in your system for 7 years. And so that freaked me out. But it got me to stop swallowing gum. So those are probably two I can think of right now that
Right.
I'm like, oh, man. But I see why she did it.
Yeah. We probably had the same family member talking about
Maybe.
Las mismas comadres ahí chismeándose. Que we're kids
Same
this
circle.
way. Yeah, same circle, yeah.
You got one, Moses?
Me, well, it would have been that, the seed, for sure, the seed. What, this is so funny. Si te cortas el dedo, te salen las tripas. You cut your finger, your intestines will pop out.
No, I wasn't told that one.
Yeah, you weren't traumatized that way? I was traumatized by that
Oh
one.
my God.
Yeah, you cut your hand, you cut yourself, your tripas are gonna come out. So,
Oh
yeah,
God.
that was,
That's a big one.
Yeah, it is a big one. So we were very careful, and you grew up in La Colonia, and you're being travieso. I remember jumping up on trees and jumping, and asked me to do that now, and I'm scared.
Oh yeah. No, I couldn't do that now.
So yeah, we were traviesos. We were out in the sun and traviesos.
They're like, oh well, if you cut yourself, then this is gonna happen.
Exactly.
Awesome. As we wrap up here, one more question. If you want to just give the audience some tips, how you stay motivated, how you take care of yourself, and just kind of what keeps you focused in your journey.
Yeah, yeah. I mean, it's a tough one, right? Because as we kind of alluded to, there was a point where I was juggling school and, the nonprofits. And so I think one of the big things is it's really easy. And I'm sure many of us can relate to this feeling where we feel like we're carrying the world on our shoulders.
Yeah.
And we can't take time off because if we do, people are going to notice and they're going to judge you. And so, no, we got to work from the moment we wake up to the moment we go to sleep. And you can't exercise either because you got to keep working. And, there was a point where I didn't even want to take an hour for my Zumba class because I have to be working. And so I think, one of my epiphanies I'll share with you all is, that we're all in the same boat and making the realization that, yes, the work we do is important, but everybody feels the same way. And you know what? If you end up taking a few hours for yourself, that is okay. Yeah. And it's okay to take time for yourself, and it's okay to let yourself enjoy a day off during the weekend where you just sit on the couch, eat some Cheetos or watermelon, and watch TV, right? And, just really unplugging. I think that's super important. And it's easy to get burnt out, and I've been burnt out many times. Most recent burnout was probably February this year. But we got to take time for ourselves because then we're useless if we're burned out and we can't work and we can't function and we can't think. So that would be my biggest recommendation for those listening that maybe are struggling with that. And again, the work we do is so important, but that's also why we got to take time for ourselves. And I guess one reason or one big thing that keeps me motivated is that, I feel that the work we do is so critical. And I am constantly encouraged and motivated by working with our partners because they do such great work. And I think working together makes it so much more worthwhile because we're stronger together. And that's been my encouragement since, starting Latinx and moving to today, where we are today. So I just appreciate, being able to sit here and work together and collaborate because it makes me feel like we're in this together. We're in this together. And so hopefully that, those are two things that, some of us can take. But yeah, it's really been an honor to be here with you.
Great. That's perfect. That's awesome. Anything else, Moses, before I wrap it up?
Thank you, Dr. Sosa. We really love conversing with you, and it's always a pleasure to be with you. So, yeah, thank you so much.
And I'll just also leave this open, Dr. Sosa. If you want to let people know where maybe they can find you, follow your work, or anything you'd like to promote or highlight before we go off air here.
Of course, yeah. So definitely you can find us on our social media, right? We're at Latinx Voces. We also have our website, latinxvoces.org, or the health website, which is latinxtaskforce.org. And you can always reach out to me too. So I'm happy to leave my email. You can reach us at info@latinxvoces.org, and we're just excited to hear from you and work together. And of course, we hope to see many of you at our summit on November 6th. It's going to be a fun one. And so we hope to see you all there. It's going to be fun, and many of us will be at that event as well. Yes. So hope to see many of you there.
Yes.
Awesome. On that note, thank you so much for joining us today, everyone. We really hope you enjoyed this episode, and stay tuned for our next one here at Unidos Unplugged. Thank you.